Have you ever wondered what could possibly go wrong in medical procedures and how these complications are handled? Let's delve into this intriguing yet pivotal aspect of medicine. Complications in medical procedures are unforeseen situations that arise during or after a medical intervention. They are the uninvited guests in the grand party of medical successes. These complications can range from minor inconveniences to severe, life-altering events. They can be as simple as a prolonged stay in the hospital or as complex as a critical event during surgery. Imagine going in for a routine procedure, expecting to be home by dinner, but instead finding yourself admitted to the hospital. That would be an example of an unanticipated admission, a complication that can throw a wrench into the best-laid plans. Then we have perioperative events, those unforeseen circumstances that occur around the time of surgery. Picture this. You're in an operating room surrounded by state-of-the-art equipment and a team of skilled professionals. Yet, despite all the preparation and expertise, something goes awry. It could be an unexpected reaction to anesthesia, a sudden drop in blood pressure, or a myriad of other possibilities. The impact of complications on patients can be profound. They can lead to longer hospital stays, increased healthcare costs, and most importantly, a significant toll on the patient's physical and emotional well-being. But it's not all doom and gloom. Understanding these complications and why they occur provides a roadmap for prevention. Knowledge is power, and in the realm of medicine, this power can be the difference between a smooth recovery and a challenging one. By shedding light on these complications, we can equip ourselves to anticipate, prevent, and manage them more effectively, thereby improving the overall quality of care. So as we delve deeper into this topic, remember, complications are not failures, but rather challenges to overcome. They are the hurdles in the race towards better patient outcomes. Understanding these complications is the first step in preventing them. Nausea and vomiting are common complications that can occur after surgery. They're more than just uncomfortable side effects. They can lead to serious consequences such as dehydration, increased pain, and even injury to the surgical site. So what causes these unpleasant reactions? Well, there are many factors at play. Anesthesia, pain medications, the type of surgery, and even individual patient factors like age and gender can all contribute. But here's the good news. We can take steps to prevent post-operative nausea and vomiting. Medically, this might include using different types of anesthesia, administering anti-nausea medications, or adjusting pain management strategies. Non-medical measures could involve dietary changes or the use of relaxation techniques. Remember, it's not just about making patients comfortable. It's about ensuring their safety and speeding up recovery. Proper management can significantly reduce the occurrence of these complications. Aspiration is a serious complication that can occur during anesthesia. It refers to the inhalation of stomach contents into the lungs, creating a potentially life-threatening situation. Certain factors increase the risk of aspiration, such as emergency procedures, obesity, and certain types of surgeries like those involving the upper gastrointestinal tract. Preventing aspiration demands careful attention. The focus lies on ensuring an empty stomach prior to anesthesia, achieved through fasting and the use of medications that reduce stomach acidity and volume. Additionally, anesthesiologists often use specific airway management techniques during induction and emergence from anesthesia to prevent aspiration. Treatment for aspiration primarily involves supportive care, including oxygen therapy and sometimes antibiotics to prevent pneumonia. In severe cases, a patient may require mechanical ventilation. In the dynamic environment of anesthesia, complications can arise without warning. Aspiration is no exception. But with thorough preoperative assessment, careful intraoperative management, and prompt recognition of symptoms, we can mitigate its risks. Vigilance and appropriate measures can help prevent this life-threatening complication. Malignant hyperthermia is a potentially fatal reaction to certain medications used during general anesthesia. This is a condition that, while rare, can have serious consequences if not promptly recognized and treated. So, what exactly triggers malignant hyperthermia? It's primarily caused by certain volatile anesthetic gases such as isoflurane, desflurane, and sevoflurane, as well as the muscle relaxant succinylcholine. These drugs can cause a rapid increase in calcium levels within the muscle cells, leading to a hypermetabolic state. Now let's talk about the signs of malignant hyperthermia. Early signs can include a rapid rise in end-tidal carbon dioxide, despite increased ventilation, along with an increase in oxygen consumption. This might be accompanied by tachycardia, or a fast heart rate, and tachypnea, which is rapid breathing. As the condition progresses, the patient may also experience a high fever, muscle rigidity, and dark cola-colored urine due to myoglobinuria. So how do medical professionals respond to this situation? The treatment of malignant hyperthermia is as fascinating as the condition itself. The moment malignant hyperthermia is suspected, the triggering agents are immediately discontinued. The operating room is then filled with a sense of organized urgency as the team springs into action. The patient is hyperventilated with 100% oxygen to help remove the carbon dioxide. The key treatment, however, is the administration of dantrolene, a muscle relaxant that reduces the high calcium levels in the muscle cells. It's a life-saving drug for patients experiencing malignant hyperthermia. Other supportive measures are also taken. These can include cooling the patient to bring down the fever, administering diuretics to protect the kidneys from myoglobinuria, as well as correcting any acidosis and electrolyte imbalances. Malignant hyperthermia is a dramatic and potentially deadly event. But with the right knowledge, a keen eye for the early signs and a swift, effective response, it can be successfully managed. Early recognition and prompt treatment can save lives. So let's keep learning, let's keep asking questions, and let's keep saving lives. Advanced age and coexisting diseases can increase the risk of complications. This isn't just a saying, it's a medical reality. As our bodies age, they naturally become less resilient, and the presence of other health conditions can further complicate matters. Imagine a garden. In its prime, it flourishes, with vibrant flowers and lush greenery. But as time goes by, the garden changes. Plants age, pests invade, and environmental conditions shift. It's the same with our bodies. The wear and tear of time, coupled with diseases like diabetes, heart conditions, or even chronic respiratory disorders, can make us more susceptible to complications, especially during medical procedures. Think of a simple surgical procedure. For a healthy younger individual, it may be a straightforward process, but for someone advanced in years or with a coexisting disease, the same procedure might be fraught with potential complications. The body, like that garden, is less able to bounce back. But don't despair. This doesn't mean that older individuals or those with other health conditions are doomed to suffer complications. It means that healthcare providers need to be more vigilant, proactive, and prepared. This is where preoperative evaluation and preparation come into play. They serve as the gardener tending to that aging garden, identifying potential problems before they become crises. A thorough preoperative evaluation can flag risks that might have otherwise gone unnoticed. It provides a comprehensive understanding of the patient's overall health and helps the medical team anticipate potential problems. Preparation, on the other hand, is the action plan. It's the steps taken to mitigate identified risks. This could be anything from adjusting medication dosages to planning for specialized post-operative care. In essence, the interplay between advanced age, coexisting diseases, and complications is a dance. It's a delicate balance of understanding the risks, identifying potential issues, and taking proactive steps to manage them. And remember, it's not about eliminating risk altogether. That's an impossibility. Instead, it's about reducing risk to the greatest extent possible. Careful preoperative evaluation and preparation can help manage risks in these patients. And with that, we're better equipped to navigate the dance floor that is advanced age, coexisting disease, and complications. Children with upper respiratory tract infections can be at risk of complications during procedures. This statement is not just a hypothesis, but a reality that healthcare professionals encounter frequently. Upper respiratory tract infections, or URTIs, are common in children. They're often caused by viruses and can include conditions such as the common cold, sinusitis, and laryngitis. While these might seem like minor illnesses, they can pose significant risks when a child needs to undergo a medical procedure. Why is that, you ask? Well, URTIs can lead to increased mucus production and swelling in the airways. This can make intubation, a process where a tube is inserted into the windpipe to maintain an open airway, more difficult during procedures. Moreover, children with URTIs can have a heightened response to the respiratory irritants used during procedures, possibly leading to bronchospasm, a sudden constriction of the muscles in the walls of the bronchioles. But complications are not inevitable. With careful planning and management, these risks can be minimized. For instance, if a child has a URTI and the procedure is not urgent, it might be better to delay until the child has fully recovered. This is because research has shown that waiting at least 2 weeks after the onset of a URTI can significantly reduce the risk of complications. However, not all procedures can be postponed. In these cases, anesthesiologists may opt for a technique that doesn't involve intubation, such as using a laryngeal mask airway. They might also choose to use medications that reduce airway reactivity and prevent bronchospasm. It's also essential to monitor children closely during and after the procedure. This involves keeping a keen eye on their vital signs and providing supportive care, such as oxygen therapy, if needed. In conclusion, while children with upper respiratory tract infections can be at risk of complications during procedures, these risks can be effectively managed. Awareness and careful planning can help minimize risks in these young patients. After all, every child deserves the best possible care, and that includes taking every precaution during medical procedures. So let's keep striving for that, shall we? Tonsillectomies and adenoidectomies, common procedures in children, can have complications. These surgeries, often performed to address recurrent infections or obstructive sleep disorders, are not without their risks, even though they are relatively safe. First, let's talk about postoperative bleeding. This is the most common serious complication, occurring in roughly 3 to 4% of patients. It can happen immediately after surgery or up to 2 weeks later. If this occurs, it's crucial to seek immediate medical attention. Next, there's the risk of infection. Although antibiotics are typically given to minimize this risk, infections can still occur. Symptoms may include fever, severe throat pain, or pus in the back of the throat. If you suspect an infection, it's important to contact a healthcare professional promptly. Another common complication is dehydration. It's often caused by pain or difficulty swallowing after surgery. Encouraging the patient to drink fluids can help mitigate this risk. If severe dehydration occurs, hospitalization may be required for intravenous fluid administration. Pain is also a significant concern, particularly throat and ear pain. Regular administration of pain relief medications as prescribed by the doctor can help manage this. Less common but more serious complications include respiratory problems such as apnea or cessation of breathing. This is more common in children with obstructive sleep apnea syndrome and requires immediate medical attention. Finally, changes in voice can occur after these surgeries. Most of these changes are temporary, but in rare cases they can be permanent, especially if the child had large tonsils and adenoids that were causing nasal speech. These complications, while serious, are manageable with prompt and appropriate care. The key is to be informed and vigilant. If any signs of complications arise, don't hesitate to seek medical assistance. Remember, tonsillectomies and adenoidectomies are common procedures, and most children recover without any issues. However, being aware of potential complications can help ensure a smoother recovery process. Knowledge of these complications can help in their early detection and management. After all, when it comes to our health and the health of our loved ones, knowledge truly is power. Quality assurance plays a crucial role in reducing complications and improving patient outcomes. This is a fundamental truth in healthcare. Let's dive into why this is the case. Quality assurance at its core is about setting a high standard of care and ensuring that this standard is consistently met. It's about creating a culture of excellence where the best possible patient outcomes are not just a goal, but an expectation. This involves regular assessment of practices, procedures, and outcomes, identifying areas of improvement and implementing changes to enhance the quality of care. Think of quality assurance as a safety net. It's there to catch complications before they become serious problems. For instance, let's consider a common complication like nausea and vomiting post-surgery. With a robust quality assurance system in place, healthcare providers can monitor patients closely, identify early signs of this complication, and intervene promptly, thereby preventing further discomfort and potential complications for the patient. But quality assurance isn't just about preventing complications. It's also about continuous improvement. It's about asking, how can we do this better? This is where quality improvement comes in. Quality improvement is a proactive, systematic approach to enhancing healthcare services. It involves identifying areas of potential improvement, testing new methods or procedures, and implementing changes that lead to better patient outcomes. For example, let's take the case of a child with an upper respiratory tract infection. Through quality improvement, healthcare providers might identify that they can improve the child's recovery by introducing a new medication regimen or by modifying the way they deliver care. They would then test these changes, monitor the outcomes, and if successful, implement them as standard practice. Quality improvement is a never-ending process. It's about constantly striving for excellence, constantly pushing the boundaries of what's possible in healthcare. It's about not just meeting the standards, but exceeding them. And it's about creating a culture where everyone is committed to providing the best possible care. So, you see, quality assurance and quality improvement are two sides of the same coin. Both are essential for reducing complications and improving patient outcomes. Quality assurance provides the safety net, catching complications before they become serious problems. Quality improvement, on the other hand, pushes the boundaries of what's possible, constantly striving for excellence and better patient outcomes. In conclusion, quality assurance and quality improvement are not just about reducing complications or improving patient outcomes. They are about creating a culture of excellence in healthcare, a culture where the best possible patient care is the norm, not the exception. They are about constantly asking, how can we do this better? And then doing the hard work to make it happen. Through quality assurance, we can ensure better patient outcomes and strive for continuous improvement in healthcare.